Laparoscopic colorectal surgery. Step-by-step procedure and recovery tips. Laparoscopic colorectal surgery is a minimally invasive technique used to treat various conditions affecting the colon and rectum. This guide provides patients with essential information about the procedure, its applications, preparation, and post-operative care. What is laparoscopic colorectal surgery? Laparoscopic colorectal surgery involves performing operations on the colon and rectum through small incisions, typically 4 or 5. A laparoscope, equipped with a miniature camera, provides the surgeon with a magnified view of the internal organs on a monitor. Conditions treated. Laparoscopic colorectal surgery can address a range of colorectal conditions, including diverticular disease, appendicitis, rectal polyps, rectal cancer, severe constipation, rectal prolapse, colon volvulus, and inflammatory bowel disease, Crohn's or ulcerative colitis. Procedure overview. The surgery is conducted in a hospital under general anesthesia. Small incisions, usually 3 to 5 and less than 0.5 centimeters in size, are made in the abdomen. Trocars, narrow tube-like instruments, are inserted through these openings. A laparoscope is inserted through one trocar to provide a clear view of the internal organs on a screen. Special instruments are inserted through the other trocars to perform the surgery, or one of the incisions may be enlarged to remove part of the colon. Preparation for surgery. Bowel preparation involves cleansing the colon, often with an enema. Patients should refrain from eating solid food for at least 8 hours before the surgery. Discontinuation of certain medications, such as blood thinners, warfarin, aspirin, or ibuprofen, may be necessary. Post-operative care. Patients can typically resume normal activities within 1 to 2 weeks after surgery. Walking is encouraged starting from the day after surgery. Loose stools are common in the first 2 weeks post-surgery. Medical assistance should be sought if experiencing watery stools for more than 3 days, nausea and vomiting, abdominal pain, pus discharge or redness around the incision, fever with chills, temperature of 100.5 degrees Fahrenheit or higher, or rectal bleeding. Conclusion. Laparoscopic colorectal surgery offers a minimally invasive approach to treating various colorectal conditions, allowing for quicker recovery and reduced post-operative discomfort. By following pre- and post-operative instructions and promptly reporting any unusual symptoms, patients can optimize their surgical outcomes and regain their health and well-being. This is for educational purposes only and not a substitute for medical advice. Always ensure that you get advice from your healthcare provider. Your condition should not be self-diagnosed or self-managed. Thank you.